what I'd like to demonstrate right now is the tracking module, and the tracking module is the way to follow patients at home between office visits. And this patient, we'll call him CHF track, is congestive heart failure. We're going to follow his weights, and so we'll set that up as part of the orders. We're going to just quickly show. We'll put the upper limit is 175, and we'll have a lower limit if we want to. We'll just make it 150 pounds. And we'll say we'll do them as daily weights. And then what happens is that it automatically picks the day it starts, which is the next day. And we will place that order. And you'll see it in the list of tracking. We can do multiple trackings as describe weights, peak flows, blood pressures, blood sugars, and abdominal girth. But for now, that's all we'll do. We'll see the order is cut there, and we'll sign it. Now I'm pretending I'm the patient, CSF track, and I'm at home and I'm taking a daily weights. So I go into my stats, and I go into my weight, and we're going to add a weight for today of 177, and we'll enter that weight there. Now with the tracking program, every day it scans the database and looks to see if there are any patients that have values outside the limits set by the physician. In this case, CHF track had a daily weight that was above the limit set by the physician. And when we click on the report, we see that he's listed in the report and tells the value that he has that is above the limit, and that was set in the tracking module, and the time that occurred. In this case, what we can do too is we can go in and look at the statistics there, in case they have a lot of statistics, to see where he's doing. We're in his PHR right now. And also we can go into the patient's chart, and probably what would happen with this report is that the healthcare provider would call the patient and write some orders and or document a discussion with the patient. And we'll just say told to limit salt, just for simplicity. And this would go, we would enter this, and this would go as a message. It shows that what it is that there's no orders that we're going to write in this case, though we could write orders. And it shows that we dealt with this patient and would go on to the next patient. So that, in the essence, is a tracking module, how the tracking module works. We also have a report for non-compliant patients. If a patient was supposed to put an order in by a given time and had not put the order in, a report is made of the patients who have not put the time, the appropriate statistics in, and this could be worked by a staff member to contact the patient and see what the problem is. And again, messages can be made as well, and you can review the messages, previous messages with this patient.